set up a formal platform to address these issues.
Welcome to Caring and Sharing, the Advanced Oncology podcast. My name is Uta Schmidt-Straßburger and I'm meeting Emmanuel Kissiedu today. Emmanuel is a specialist hematologist at Cape Coast Teaching Hospital in Ghana. He is a final year student of the Master in Advanced Oncology program of Ulm University, and he is the founder of the Blood Cancer Foundation Ghana. Welcome.
Thank you very much, Uta. And how are you doing?
Thank you. I'm looking forward to our conversation.
Absolutely.
So you recently have founded this Blood Cancer Foundation. And I would like to know what drove you to do that.
All right. So first of all, thank you very much, Uta, for having me on this program. And it's an honor to be here this morning speaking to my scientific director, which is you, of the Master's Online Advanced Oncology program at Ulm University in Germany, a program that I started in 2023. And I am currently in my final year. And I can actually say you've been a great mentor. Your kindness and leadership has allowed me to establish a foundation that I plan on talking about today. So once again, thank you for creating this platform and allowing me to voice out my plans in helping to improve the management of blood cancers in Ghana. So I'll go straight to the point. So why did we establish this foundation? We did an analysis this year. So we compared 2023 to 2024, the data that we had, and then we noticed that there has been an increase in the number of hematological disorders. So between 2023 to 2024, over 2024, we noticed that there's a 58.6 rise in the number of hematological disorders, including blood cancers, of which non-Hodgkin's lymphoma was the most commonest, and this was followed by CML for our OPD cases. And then for the inpatient cases, we managed AML, a lot of AML cases, and NHL was the second most commonest. And the second reason that the trend of performance over the period of 2024, we noticed that there has been an increase in the number of admissions. There is a reduction in the number of patients who are going into remission whenever they have their treatment. There has been an increase in the number of patients who are relapsing after treatment. And then there's also an increase in the number of mortality. So we did a retrospective analysis and just to find out the reasons why we are having all these issues. And then we noticed that the real situation in Ghana is that there are certain factors that cause these issues. So that is the reason why we decided to set up this foundation to try and address these problems, just set up a formal platform to address these issues.
If I dare interrupt you, so the data that you've been analyzing are the ones from the patients you've been seeing, right? So it's more like a hospital-based cancer registry.
Absolutely. It's a hospital-based cancer registry, hospital-based.
And have you also analyzed other data in retrospect, so older data or maybe also population-based data?
Yes. We are in Ghana. So the first data that I analyzed was a data that was done or published some years ago between 2012 and 2016. And we noticed that there were similar findings. And when we compare it, we realized that the number of cases that they used to have in the past, which was within that year, if you compare it to the current data we have now, we realize that there's an increase in the number of cases. So Ghana was the first. The data that was done some years ago in Ghana, specifically Kulebu, was the first one we compared our data to. And then we also compared to the data locally, the one we had in our teaching hospital. We compared it to the last year cases, and then we realized that there has been an increase in the number of cases. And we also compared it to data close by, which is Nigeria. And we realized that, for example, Nigeria in 2021, a study that was done by Ugu et al. Indicated that the frequency of non-Hodgkin's lymphoma was around 21 or 22%, and it wasn't too different from ours, which we currently have, which is 28.6. So if you compare it, you realize that there's a gradual increase in the number of cases that we are having in our facility and in Ghana.
So what is on the agenda of the Blood Cancer Foundation?
the agenda for the blood cancer basically stems from the problems that we've noticed. So I'll just go through quickly the problems that we noticed before I tell you our agenda. So we noticed that there is lack of awareness and inadequate education in the general population. So patients tend to do self-medication before they present very late to the hospital. There is also inability to afford recommended investigations for adequate diagnosis. So some patients are able to do a blood film comment. To step up to even do a bone marrow aspirate for their diagnosis is a problem. There's also inability to purchase medications that are needed in their management. So, for example, filgrastim, the chemotherapy that they need, and even WHO essential list medication like rituximab is extremely difficult for these patients to purchase these drugs. The average health worker in Ghana is also not aware of the clinical presentation, so there is a delayed referral and delayed diagnosis of these patients. And there's also the unavailability of adequate supportive therapy like red cell concentrate and platelet concentrate, poorly resourced health facilities to manage blood cancer patients, and there's also absence of quality research and local data to manage our patients locally. And lastly, there's also the absence of a functional stem cell transplant facility, something that we hope to obtain in the long term. So the agenda for our foundation is basically simple. We want to create awareness and education because from the situation that I just told you, we realize that a lot of our patients are not aware of some of the presentations. So we want to raise awareness and education. So our plan this year in 2025 is actually educate people through social media. We plan on going on trips to the universities, to schools, to churches, even in our hospital, the local hospital. We just want to create certain awareness and educate the people for them to understand what blood is, that blood is, it's not just liquid, it contains cells, and the problems that come from that is the leukemias and the lymphomas come from or stem from these cells that we are going to talk to them about. And also, apart from raising awareness and education, we want to support the patients and empower them. We want to improve their access to treatment and care. So one of our aims is to speak to the government, probably the diagnostic tests that they have to do, the treatments that they have to obtain, they can put them on the insurance so that these patients can be able to obtain them at a very low cost. And also talk to some other policy developers to help reach out to our patients. And then also, more importantly, research so that we can have local data that can better manage our patients. So these are our agenda for the foundation.
Well, you've got your work cut out for you, and
Absolutely.
I don't think it will hold anytime soon. So I really compliment you on the founding of this foundation. It's mainly driven by you as a person, and I think you were so passionate just now talking about everything that's on your heart. And of course, me as an educator, I always like it when you want to educate people and just explain how things work and what we do know so far and what we still need to learn about things, and also how to manage things best under different and sometimes very difficult circumstances. So thanks a lot for joining me today, and I wish you all the best, and I hope that this little podcast episode will contribute to the visibility of the Blood Cancer Foundation Ghana, both on social media, but also on the professional social media like the LinkedIn that we will be covering as well. So thanks a lot for joining me, dear Emmanuel, and I'm looking forward to seeing you soon in person. Bye.
Absolutely. Thank you very much. Hope to see you soon. Thank you.